Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to this special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from the HIMSS annual conference in Orlando, HIMSS24. Broadcasting from Radio and Podcast Row. Before we get too far, though, let me thank my radio and on-air producers, Greg Masters and Roberta Mullen. Thank you so much, team. Some of this came together at the last minute, and Greg was fantastic, and Roberta is always amazing. It's great to work with you guys always, and this is actually my 10th year straight as my first broadcast was live from HIMSS24 in Chicago. So thanks again for helping me keep this streak going. That was a phenomenal event and launched a great annual trend of key thought leaders sharing best practices and strategies to successfully navigate the future of healthcare. So over the next few days, we're bringing you the latest in industry's most sought after CEOs, CIOs, care providers, policy leaders, and visionaries. If you missed any of this episode and broadcast, all my content for This Just In Radio is posted at iTunes, iHeartRadio, SoundCloud, Spreaker, Google, and on the TuneIn platforms. As many of you know, my goal for broadcasting live each year for the HIMSS annual conference is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. We're also fortunate to have many of these guests as initial members of our health innovation think tank, where we transparently share healthcare and digital health best practices, as well as key strategies. You can find out more about the think tank at healthinnovationthinktank.com. My goal, along with all my guests here, will be to offer tactics and strategies to not only survive, but to thrive. You're going to even hear that from my good friend Rasu Shrestha, who will talk about surviving and thriving in his upcoming episode. But it's important that we all thrive as we navigate our hospitals, physician practices, our companies, or even your families through all these changes occurring in healthcare. There's more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. I hope you glean all of that over the next few days of broadcasting. That's at least my goal. Thanks again, and off to my next guest. Welcome back to This Just In Radio show, broadcasting live from HIMSS24 in sunny Orlando. I'm excited to introduce my next guest, Philip Bradley, Digital Health Strategist with HIMSS. Welcome to the show, my friend.
Thank you so much. Glad to be here.
It's been a good conference so far?
It has been. It's been a lot of people, a lot of handshaking.
Yeah, exactly. I know. My last guest, Anish, we're just talking about a lot of new faces as well. I think this is my 24th HIMSS, I believe, something like that. And, it's been great. It's old home week, so there's always, 200, 300, 400 of your closest friends, but also a lot of new faces in this industry. So it's kind of exciting from that perspective.
It is.
So tell us a little bit about you're new to my show, so give my audience a little bit about your background. And
Sure. I have been in the IT field my whole career. I don't want to say how long back, but I've been in healthcare since the mid-'80s.
Yep.
And been coming to HIMSS since the mid-'80s, using it as an education tool. I joined HIMSS just shy of 8 years ago, responsible for the EMR adoption model. Mm-hmm. And last year, I was asked to modernize the infrastructure adoption model, which is my focus for this week at HIMSS.
Yep. So before we dive into the infra model and all the advancements that you've made, actually, I like to start off on a really positive note because so many great things are happening in the industry. What progress are you most excited to see occurring in healthcare today?
Well, from the IT side, it's the availability of technology that's really starting to make a difference, not only in the life of the patient, the things that we might wear, the things we can take home, sharing data with the clinicians, but on the clinical side, better tools for their workflow. We still got work to do, of course.
Absolutely.
But starting to see real progress in the use of the technologies as it becomes more affordable and available to more organizations of all sizes.
Yep. Excellent. Yeah, and actually, Anish brought up a great point in the last show, just talking about how, we are able to scale now innovation. While some is increasing costs, some are also able to decrease costs now, which I think is we're starting to see, which is actually really exciting. Deflationary aspects to healthcare, because we all been working very hard at that for a long time. What is your background? Do you come from the technology side, the information management side? Which side of healthcare and technology do you come from?
It's been a while in my past from the technology side.
Mm-hmm.
I moved into management in the 90s and been in senior leadership roles in healthcare over the past 25 plus years.
Yep. Excellent. And we're not too far off. My first HIMSS was in 1995, I believe it was. So I'm getting up there as well, but wouldn't turn back the clock for a second. So tell us about the IMFRAM model. First of all, what does it stand for and how it has, initially evolved?
Yeah, it's infrastructure adoption model, IMFRAM.
Yep.
And it has 5 focus areas. Cybersecurity, no surprise.
Very important.
Based on existing frameworks, both U.S.-based and international-based frameworks. We have IT management and performance, which is how well does the infrastructure perform? How well is it managed? Does it meet the objectives of the organization? Adoption, that's where we get into looking at infrastructure that we put into the hands of the clinicians or the patients. Are they actually using it as expected? And then outcomes. How are we driving improvements in the organization through these investments and infrastructure so that we can communicate it? We had a vendor yesterday describe it very well as a Rosetta Stone for executives outside of IT to communicate to. So it's been very helpful. And then the final is sustainability. Sustainability in terms of is the dollars that I'm spending today going to be beneficial tomorrow, as well as a carbon imprint. Carbon impact is very important. Healthcare in the U.S. accounts for a little more than 8% of greenhouse gases in the U.S.
Right. Okay.
So we have a role,
absolutely,
to be more mindful.
That's excellent. Great point. So, how does an organization get involved?
Well, there's a lot on our website, HIMSS.org, and you can get an overview of what IMFRAM is, as well as our other adoption models, IMRAM being the one that people know most.
Yes.
And there you can ask for a survey. It's a self-assessing survey where we suggest you get around the table with the right people. And you can complete it in about 3 hours, depending. But that's what, on average, it has been. And then the results of that survey come back to us, and we put it through our magic formulas.
Your algorithms, yes.
Our algorithms, and show you where you are. And most important, it's a roadmap. How do we improve to move to the next stage?
It's excellent. So would this be a CTO, CIO, all the above leadership?
It usually starts in at CIO, CTO, CISO roles, but it's expanded out and is important to non-technical executives that are responsible for productivity of service lines, performance, and job satisfaction in service lines.
Yeah. Excellent. So what are the most significant benefits for an organization to engage? I mean, obviously you mentioned the roadmap is really important, and obviously you got your 5 tenets, but yes, please explain.
It's looking outside your 4 walls of how well are we doing?
Right.
Are we on the right track? Are we in step with what the rest of the industry is doing? And are the investments that we're making today going to be sustainable for tomorrow and help us as we move forward? It's a way of deep reflection, if you will, as the questions are meaningfully challenging.
Good.
That's why I said we need to have the right people around the table. Just don't give it to somebody on Thursday afternoon and say, knock this out.
Yeah. Good point.
And get a meaningful response so that the roadmap that we give you back is more meaningful.
Yeah. So I guess that's a great point. I think let's spend a second on that, because there's I think you just offered a best practice, because sometimes we move so fast, we don't realize, our actions and hey, Mike and Susie, maybe knock that out and bring it back. And that's not exactly the best way to go about it. So if you have to offer some thought leadership, somebody say, hey, this is the best way to approach these questions in this survey, how would you, so what were maybe 2 or 3 best practices there that you would offer to somebody?
You be realistic, number one. A lot of times we see organizations being pessimistic. They'll say, well, we're not really doing that. And when we have the conversation post-survey, we find, you are doing that. You're doing very well. Yeah. So give yourself credit where credit is due. And we see organizations being overly optimistic. Yeah. Oh, we do all of these things. And that's why we do a validation to say, are you really? Let's go through it. Yep. What's the evidence? So we want to see that, and don't take the output as a reflection on your past performances.
Right.
We do have organizations that will take the survey and do very poorly and blame it on the survey. And that's a
that doesn't sound helpful, though.
No, it's not. It can be a painful conversation. But they usually come around and go, okay, I understand and what we need to do, and then they have the roadmap to go forward.
Very helpful. So, there are 8 stages. Is that correct?
Yes.
0 to 7.
0, you have nothing.
Yep.
7 is the highest level, and MFRAM at 7, you're starting to use very advanced analytics to manage your infrastructure, to identify data and improvements to other executives, not just inside of IT, but the adoption and outcome components as well, so that you know that the investments you're making are having an impact that you expect.
At a stage 7, is there a handful of organizations? Is it 5%? Is it 2%? What are the ballpark?
Well, in MRAM, it's about 10% of the market is at stage 7.
Excellent. Okay.
15.
That's great.
It is. And we would love for that to be 90%.
Right.
The adoption models are aspirational.
Right.
They're not something that you just take the software out of the box and you're at stage 7.
Right.
It takes some real effort. And on the infrastructure side, since it's so new, we have 2 international organizations at stage 7, and we just validated Intermountain Health last Monday at stage 7.
Great.
They're the first on this new model.
So that was my follow-up question there is, are there a few organizations that we should know about? And is there one that we may not have ever heard about that's at stage 7 or some small community might know them, but they're not a popular name out there? Is there, not to put you on the spot, but
yeah, a little bit.
Yeah.
That's okay. At stage 6, we have some of those. I'd prefer not to throw them out there because I don't have permission.
Right.
But the model's intended to measure any size organization, health organization, and their use of technology.
Good. It's great. Well, I highly encourage people to do it just because it's obviously very valuable and it's what our country needs and our patients need. Yeah. So, love it. So thinking out, now putting on your thought leader hat again. So what are some of the trends that you're seeing out there that's encouraging to you? Either healthcare trends or digital health trends?
I think the biggest trend, and it's all over the floor here, is artificial intelligence.
Yes.
And I like to be very careful using that term because it's overused. I say that if there's an if-then-else structure underneath the covers, that's not AI.
Right.
That's just a good algorithm.
Correct.
So I think that it is a real opportunity for improving physicians' lives, making some of the routine things easier. And I'd like to see it go at a slow pace. Mm-hmm. On the technology side, AI is becoming very valuable in identifying anomalies, whether it's cybersecurity or performance issues. So I like that scope of AI. Yeah. The other is there's been more interoperability and making sure that the physician, the care provider, has the information they need to know. We've made great strides in that over the years, not just in exchanging the data, but putting it into a meaningful format for the docs.
Yeah. Nope. Excellent. Great points. And I think Halamka validated your first point and Anish Chopra just validated your second point there. So, I totally agree with interoperability and then the AI and the AI side, I think John hit on basically on the care side, really how we're looking for anomalies. And that's a great strategy that we'll continue to look at. And we all want this to go slow, ethically, morally, and really, see AI mature at a managed rate, and that we use, proper use and, inside and outside of healthcare, but obviously being here in HIMSS. Yeah. So what do you hope to achieve in your final days here at HIMSS24?
Well, get the word out about the new MFRAM model for sure. I've got a number of speaking opportunities already. Shake a lot of hands, like you said at the beginning of it. This is a reunion of sorts, a lot of familiar faces and a lot of young new faces, which is exciting.
You got it.
Really to help the organizations, the adoption model is the tool, but to really help organizations understand there is a process to manage your infrastructure maturity in a responsible way. Mm-hmm. We as IT technologists are never given the directive, go out and buy me the most expensive infrastructure.
Right.
It's our job to find the right infrastructure at the right price that delivers the right capabilities for the organization.
That's a great message. I love that. So, yeah, I mean, this is, I said this in my opening talk for my first guest. HIMSS is what you make it. Everybody's here. And if you set, properly plan, I think even John and I talked about making sure that you have the right plan and the right strategy coming into this conference, but you can achieve all your goals.
Yep.
And if you don't, that's on you, because everything is here. Everybody's here. Every ounce of innovation, technology, strategy, automation, workflow, whatever you want. Is all here. So it's a great opportunity. Well, Philip Bradley, thank you so much for joining me on air. Appreciate you, and good luck. And I know that you're achieving your goals, because I dived into the infrared model and very impressed by it. So
thank you very much.
Yeah, thanks, Philip Bradley with HIMSS. I'm very excited to introduce my next guest and great longtime friend of the show, Tom Foley with GenieMD, and also host of the Virtual Shift. Welcome back to the show, my good friend.
Awesome. Thanks for having me.
You got it. Always. Glad this worked out. So first, tell me about your goal for the show, and has it been action-packed so far?
It has definitely been action-packed. This year, GenieMD did not do a booth, but we've been very busy yesterday and so far today. So
excellent.
It's exciting.
When'd you get in town?
Got in town. I actually live here in Florida, so I drove up from Southwest Florida Tuesday morning and got here for the keynote.
Excellent. Yeah, I actually came in. We're from similar areas. I came in on Monday morning, but I don't know if I hit pretty bad traffic. It took me almost 3.5 hours from Sarasota.
Route 4 is a killer.
Yeah, it really is. Oh my gosh. I even tried to do some back roads around it because it was just so bad, but it still took me 3.5 hours. Excellent. So I like to start off with something positive. What progress are you most excited to see in healthcare today?
Well, I'm a bit biased because I am in the virtual care arena, but I think 2024, more than previous years, there has certainly been an uptick in interest in looking at how virtual care can enhance the delivery of care model, and how AI can actually further simplify and enhance that patient engagement model.
Very true. So elaborate on that. I mean, I guess from a standpoint of what aspects of virtual care have you seen the uptick in, and what's the exciting part behind that? Yes.
So for us, it's so we could talk about telehealth, remote patient monitoring, chronic care management, all those different virtual modalities. But for us, we talk about it a bit differently, right? A lot. It's okay to talk about how I can enhance medication adherence. I can reduce emergency room visits. I can reduce your hospital stays. That's great, right? But I still have diabetes,
right?
And I'm still obese.
That's right.
Right. Yeah. So how does the care management side of these virtual care modalities engage that patient to get that patient to lose weight in a positive way? And just because I always say, and my father has diabetes, he had the worst case of it. Just because you have it doesn't mean you have to die with it.
Right.
So there's ways. So that's really where value comes into play, right? Because the first year you can say all those statistics of how I reduce things, but again, I still had the chronic condition that I had, and we had to focus on not managing it, but putting that into remission, and that's the difference. And that message is really resonating this year.
What about the reimbursement models behind these, behind RPM or CCM and some of these? What are you seeing there?
Yeah, so it's definitely it definitely helps. You can go to the provider and you can talk about again all those different outcomes of care. What we talk about in virtual care, not virtual, value-based care, is that attribution. How to specifically map a tactic, if you will, that you're engaging and attributing it specifically to an outcome and therefore saving dollars. But we also talk about those virtual care modalities in a fee-for-service model that says, hey, so the question is, how are you going to get the value? Right? So that 2030 model is hanging out there, but so how are you getting there? And the doctors are, I always say, on a hamster wheel because they're seeing 20, 30 patients a day. They don't have time to think about, to be very strategic about how I'm getting the value. But if you're adopting remote patient monitoring, chronic care management, and those other virtual modalities, and you're getting the outcomes that I talked about earlier, that's your model on how you're going to get the value. Excellent. And then that attribution comes into play once you're in that value-based care, risk-oriented contract.
Yep, excellent point. So what healthcare or digital health trends are you seeing in the industry?
Well, everybody's here at HIMSS
Yeah.
talking about AI.
AI, yeah.
So the question is, how are you responsibly using AI, right? And I'll talk about,
Yep.
as a perfect example, ChatGPT. You can ask ChatGPT today, how many Tylenol can I take, right? And it's going to give you the PI information, right? And the patient's going to take it.
Right.
But
Yeah.
if you ask it in a contextual way through a responsible platform, that platform can say, hey, this patient is on X, Y, and Z meds.
Right.
And the answer is going to come back saying,
Very
don't
different.
take it.
Right, exactly, yeah. Very
Right? So
different.
that's how AI, in a responsible way, needs to be looked at.
Yep.
It's not just AI in and of itself.
What are any of the trends that you're seeing out there beyond AI, or
Well,
maybe here at HIMSS, or what you're looking for?
The home, and the home.
Yeah.
That home is going to be becoming the center of care. Older, ager, sicker population, less doctors and nurses. The delivery of care model that we know today will not be here in 2030. There has to be a different way in order to manage that growing population, that sicker population, with less clinical services. We have more people with diabetes today than yesterday. More people obese today than yesterday. So we're not really, we might be bending the curve on cost, but we're not bending the curve on
Health.
outcomes.
Yeah,
on
absolutely.
Health.
Yeah, absolutely not.
That's
Yeah.
where we have to
We're
focus
sicker.
on.
Yeah, absolutely.
And so that home, it's not what happens when you're in the doctor's office that it matters.
Yep.
It's important. But what happens the other 8,745 hours? The average Medicare patient is in front of all their doctors 15 hours in a given year. You know this from previous conversations. What happens the other 8,745 hours, right? That's where wellness takes place. And if you engage the patient in the home, that's when you're going to get the outcomes that you're striving for.
It's excellent. So I guess following that train of thought, what are a few, 2 or 3 best practices or strategies that can help others navigate those trends, navigate that?
If it doesn't involve a robust patient management, patient engagement model, then you're most likely not going to be successful. Don't follow the baseline of what you need to do to satisfy reimbursement for remote patient monitoring and chronic care management. 16 measures as an example. We don't even talk to the patient about 16 measures. We talk to them about their care plan, about the need to take it twice a day. So if in one day we already know that, and they haven't taken their vitamin, they're already down 2. Right. So we're already on them because we're talking to them, not once a month type of thing. It's a true patient engagement, coaching, wellness approach to the delivery of care. That's ultimately how we get to the success models and the outcomes that we get.
Do you specifically, so follow up specifically on that, do you provide the care yourself, or do you push the care through your customers, or?
No, actually, that's a great question. So GenieMD is a bit different. So GenieMD provides not only the platform, but we provide the care managers. We provide a full end-to-end scenario. But if we're working with self-insured employers or payers, we have the GenieMD medical group, separate organization, right, that will provide virtual care, right? So we have a model as an we're working with a payer. Our providers will see that patient, and they will onboard them through a new patient engagement, and then validate whether or not they qualify for the program, the virtual programs, RPM and CCM. And then that virtual doctor will manage that patient through the life cycle. So that's a bit different than just an RPM company going to a practice and saying, "Hey, use me. I can save you money, or I can make you money." Right. Much different.
Excellent. So, thinking beyond today, what are a few key strategies or trends that we must be ready to navigate in 3 years from now?
3 years from now. Well,
I know it's hard.
It's 2023, so you're talking about 2027. 3 years away from every provider. 1.1 million provider today are in a fee-for-service model. How are we getting the value? So now is the time to explore, take risks, and validate what that model is going to look like to move you into that arena. And if you're not focused on patient engagement and that patient being in the home, the home is now the new setting of care. And in 3 years from now, I think that you're going to see that model more prevalent than ever in the past. And in that engagement, that I say engagement, but it's really that, we need to find a different way of coaching that patient in the 8,745 hours that they're not in that brick and mortar facility on how do we get to wellness.
That's excellent. So I guess kind of as a follow-up, what have you seen here over the last couple of days? You said you attended was it the patient experience keynote yesterday? Like, what did you see? Anything that you like in there? Or?
Let's see. I didn't walk away, with all due respect,
right.
I didn't walk away overly excited, but because a lot of, we need to get into the material results side of the house as opposed to the vision, right? The vision is great. Right. I love it, right? I'm excited about it. It's how do you get there? And that's where the brass tacks comes into play. How do you deliver it? What are you doing today? Constantly changing your model to enhance it for what's coming tomorrow. So,
excellent.
Hopefully that answers your question.
Yeah. And so, what else have you seen? Anything else at the show?
So there are a lot of very interesting AI platforms. Frankly, I think responsible integration of that. We're already integrated with ChatGPT, as I talked about earlier. But there's other ways in which we can integrate that platform and use some of that analytics, the analytics side of the data within that data, to be more intelligent about honing in on that patient that needs maybe more attention than another, right? But there's definitely, I'm a full believer in the AI, and there's some interesting players here that can certainly make that happen.
So what have you? I completely agree. So what are your final goals here? You'll be here through Thursday?
I'm actually leaving at the end of today.
And today?
Yeah.
Any other goals for the rest of your time here?
We're just at the end. We have a couple hours left. We're just walking the halls and looking at our books and seeing what other vendors that pop to mind.
Yep.
It's interesting what you can find when you're just walking the halls.
That's right.
And that's a great point. You just have to be open and think about it and just ask tons of questions. Right.
Yeah. I only had a couple of hours free, so I did the same thing. Before here, I had an hour to walk around the show floor. At 3:15 today, or 3:30, I get free up again. I'm going to walk the show floor a little bit more.
Yeah. Exactly. There's a lot here.
Yeah.
There's definitely a lot here and a lot to learn.
So in that direction, anything that you're surprised about this year? I guess I'll lead the witness a little bit from my perspective. I was surprised how busy it was because obviously HIMSS has been going through some maturations.
True.
And then, it's very well attended. Also, a lot of new faces. So a lot of, Old Home Week, a lot of us have been around for a long time. But also, there's a lot of new faces here. So, what are your thoughts?
I was thinking the same thing actually on the new faces front, and it is very well attended. A lot of people on the floor, and you can see a lot of. I've been to a lot of booths. Having done booths for the last several years, it's surprising how busy some of these booths are. Which is again exciting.
Yes.
People are engaged and they want to learn and they want to see what you got to offer. So that has truly been exciting.
Yeah. Excellent, Tom. We're right at 13. Great job, my friend.
Awesome.
Tom Foley.
Thank you.
Thank you for joining the show. You got it,
my
friend. Thank you. Have a good rest of your show.